Well, I'm Mrs.Sangeeta Fulmali. I'm age 63 years old. Previously, I had severe backache. This was for around 7 to 8 years. Then it started getting worse for the last 3 years. I attributed it to my since I have gout as well as rheumatoid, I attributed my pain to rheumatoid arthritis. 2.5 years back, when I was in US and was traveling back to India, I couldn't walk at all when I was at my son's place. I thought it was due to the work that is there. There is a lot of work to be done in US. So I thought that it is all due to the work, and again my arthritis had relapsed, my rheumatoid had relapsed. I was absolutely on the wheelchair. I was put on the wheelchair all throughout my flight, even at the stopovers. And when I came back to India, I cried almost for 2 or 3 days and decided that I should never travel back to US at all. When my son called me again, I said absolutely no. But all the time I was thinking that this must be a rheumatoid pain, and my gait was also too bad. I just couldn't walk properly. I was heavy on my right foot, and I did not comprehend that it must be a spine problem. But when I started getting shocks on my right leg and again on my foot, that I couldn't stand for a single day, for a single minute, on my foot, and even walk for even 10 steps. Then I thought something was wrong with me. I had tried before for those 3 years. I was trying all the alternative medicines, like taking shock, using TENS machines, as well as heat pads, painkillers. And since I'm having diabetes, I'm having some rheumatoid gout, all these things started having a negative effect on my kidney. Yet I did not think of going to the orthopedics. I don't know, I'm really sorry about why I did not visit. Once I visited the orthopedic, he directed me to Dr. Hadgaonkar. And I should say that Dr. Hadgaonkar has done such an excellent job with steady hands, and I can tell him that he is having such a lot of concentration to do such a critical operation, because I was diagnosed with spondylosis, or it might be spondylolisthesis. I do not know exactly, wherein my disc had come out and my vertebrae was out of shape, and then my vertebral column, it seemed, had lost its you can say its stability. I did not have a stable vertebral column. For that reason, when I visited him, he told me that I should do that operation immediately. I was not in no two minds at all, because I had surveyed Dr. Hadgaonkar's about him, and he had a 5-star rating, and that is why I made a choice that I visit Dr. Hadgaonkar itself. And I was quite happy that I was in safe hands. I knew I was in safe hands. And since I had heavy sugar and I had taken medicines for sugar on the day of operation, everything was done in the Sancheti under one roof, all the tests and all. And I should say he has an excellent team. The resident doctors attended to me previously to do all the checkups. It was done within 9 hours or so. The next day immediately I was to be taken in the morning at 8:30 for the operation. But unfortunately my sugar levels came down. But they took utmost care to see my sugar level again rose. And I was taken to the operation theatre at 12:30. By 6:30 or 7 I was out, so it seemed like a very, very critical operation. But I should thank and bless Dr. Hadgaonkar, for he was a disguise in blessing, means he was a god to me at that moment, because everybody spoke about my spine being bad and my nerve conditions being extremely, extremely bad, and again the fears of it that I would not be able to. It was a dicey situation where I would be able to walk or not walk. But Dr. Hadgaonkar did such an excellent job. He has the precision to do his work so excellently that within 2 days, I was helped by the physiotherapist to walk, and I could walk. On the 5th day I was discharged. I stay on the 2nd floor and I walked. Since I do not have lift for my building, I climbed all the steps, and on the 5th day I started walking, not only in my house, but I just would get up, and on the 7th day I started sitting and doing all my jobs, because I like to do my own job and quite having an independent attitude to do all my work personally. Though I have a maid for all things, but I like to do my work. From 7th day itself, I just started having, she just cooked my rotis, but I would stand and do some of my food, also cooking and all. By 9th day, 10th day, I think on the 15th day, my bandages and everything was removed and absolutely no pain, and I started walking from 5 minutes to 10 minutes to 20 minutes in my house itself. And on the 30th day, I started driving. So no, not 30th day, I waited for 45 days. But on 30th day, I started just moving around. In between, I would like to say that between the 40th day to the 50th day, my husband had a severe heart attack, and I could attend to my husband in the hospital except during, and he was kept in the ICU. As all my children are in the States, I could attend to my husband independently. I think if this operation would not have been done, I could not have rushed my husband to the hospital during his heart attack time, nor could I have attended it. It's all thanks to Dr. Hadgaonkar. He put me on a strong footing, and I can walk now very well, and I have no words to describe. Again, speaking about Sancheti Hospital, they have excellent staff over there to take care of the hospital. The cleanliness was up to the mark, the sanitation was up to the mark. Even the IR wise as well as the Mama Maushis who gave me bedpan, great thanks to them. Again, about all the staff and everything, it was an excellent thing the hospital has done, and I had come during the COVID area. This was in September. So all thanks to the Dr. Hadgaonkar, his team of doctors, the one who took pre-care, the post-care, as well as everything. It's God bless Dr. Hadgaonkar and his team as well as Sancheti Hospital. I just say thank you, doctor.